Download the Tips for Coaches and Tips for Parents fact sheets to learn how adults can help student athletes avoid misusing opioids and safely recover from injuries. Tips for Coaches covers the risks associated with opioid misuse, how to help prevent opioid misuse among injured athletes, and ways coaches can support recovery. Page 1 walks through the risks for student athletes to misuse prescription opioid pain relievers like more access to medication due to higher chances of injury, neurobiological susceptibility, devastation or frustration about an injury or inability to play, not knowing about the risks of taking opioid pain relievers, and feeling pressured to play. To help prevent student athletes from misusing opioids, coaches and athletic staff can teach teams about how to prevent injuries before they happen, ask students to stop playing and rest if they feel pain, teach teams about the risks of taking opioid pain relievers and taking medication differently than prescribed or prescribed for someone else, and demonstrate how to deal with pain appropriately. Coaches can provide critical support to an injured student athlete during their recovery. Here's how. Help them follow through on treatment and rehabilitation recommendations. Encourage them to take as much time off as they need. Encourage them to speak to their school counselor or healthcare professional about how they feel about their injury. Help them stay involved with their team and teammates while they recover. Work with the student athlete and athletic trainer to create a safe return to play plan. And encourage them to ask the school for extra support as appropriate. Lastly, look out for signs of opioid misuse. Recognizing these signs can help identify student athletes who need intervention and could prevent student athletes who are misusing opioids or other illicit substances from influencing others, like their teammates. Signs include changes in exercise habits, small pinpoint pupils, nausea or other stomach discomfort, skin itchiness, changes in hygiene, spending less time with family and friends, and tiredness, which may include drifting in and out of consciousness. Click here for video tours of other resources in the toolkit.